Let's move on to the treatment of nausea or the antiemetics. It's actually a huge category of drugs. We have the serotonin 3 blockers like on ondansetron. We have the dopamine 2 blockers. We have the histamine 1 blockers. We have the antimuscarinics, the corticosteroids, cannabinoids, which is a relatively new category, and the neurokinin receptor antagonists. Let's move on to the histamine antagonists. Now, we discussed some of these histamine antagonists already in our psychiatry lectures. H1 blockers include drugs like diphenhydramine, which is also called Benadryl. Now, some of the phenothiazines that are used in psychosis are also actually quite good antiemetics. And I would encourage you to go back to those lectures and have another look at that just to understand how they're working in the brain. Now, these agents are also used in allergy, cough, and cold flu medications, so they're very commonly used. They're very, very good at their activity, and they're actually sold over the counter. Interestingly enough, they're now being used as a recreational drug, particularly by people who are of lesser means, and it's a worrisome change in our in the way that we sell medications over the counter. Scopolamine is a well-known antiemetic. It's used as the primary antiemetic in probably most of the countries in the world, except the United States. It's used in preoperative analgesia, in seasickness and motion sickness, ocular irritation, and irritable bowel syndrome. So it's one of these drugs that's on the 100 most effective or most useful drugs in a healthcare system put out by the United Nations World Health Organization. It's available as a pill, as a patch, as an eye drop, and also intravenously. So you've probably heard about scopolamine patches. They're very commonly sold before you get on your first deep sea fishing expedition. Let's move on to the serotonin antagonists like ondansetron. Now, this is a very, very effective group of antiemetic drugs. And in fact, we often use it in cancer chemotherapy. We also use it in general anesthesia. So a lot of people will get quite nauseous with general anesthesia, particularly in the recovery phase, and ondansetron works quite well. Remember that this is an anti-serotonin 3 receptor agent, and like I said, it's very, very effective. Corticosteroids are sometimes used with emesis. Now, dexamethasone is a very commonly used agent in our cancer chemotherapy. It's a corticosteroid, so it reduces swelling, which is an important component. But the nice thing about dexamethasone is that it also has huge antiemetic effects in cancer chemotherapy regimens. It's generally thought of as a very strong corticosteroid, a very good antiemetic. It's only available in intravenous form. Let's move on to the new class of drugs called the cannabinoids. Now, the cannabinoids clearly derive from marijuana. These are the agents that are currently available in the United States, Canada, and the UK as cannabinoid agents. They are oral medications, and they're actually fairly effective. They are associated with an increase in appetite, which is unlike every other single class of antiemetic medication. We use it in cancer chemotherapy now, and it's quite effective. And the nice thing about these agents is that because the patients actually have an increase in appetite, we don't see that huge weight loss that we sometimes see with other antiemetic and chemotherapeutic regimens. Now, with respect to comparing it to marijuana, these agents objectively are far more effective than marijuana. And that's actually makes sense, because if you think about the way that we develop drugs, 90% of drugs come from plants. And the drugs are so much more effective than the plant-based remedies that they are coming from. In marijuana's case, there's a huge political lobby pushing its use. Most marijuana users want to smoke marijuana rather than take the pills because somehow they think it's more, I would say, natural. They're not as effective, clearly. And the problem is that the patients end up smoking so much marijuana that they become quite stuporous, and I think the side effects are probably worse than the actual treatment. The new class of agents called the neurokinin inhibitors are quite interesting. They inhibit this newly discovered NK1 receptor, which is also found in the area postrema along with the serotonin agents. They are activated by a substance called substance P, and there are other tachykinins, which are newly discovered as well, that are activating this same receptor. They are actually quite powerful, and they're used in combination with other antiemetics in chemotherapy that is highly emetogenic or really nausea-producing. They're also used in refractory hyperemesis. So patients who are not responding to other agents, we use these agents, and wow, it works quite well. This is the new generation of antiemetic therapy. You should know it. And just because it doesn't show up on old exams doesn't mean it won't be on new exams. And so I guarantee you it will be on the new exams.